Hi, this is Tanner with CompleteSpeech. Today I want to talk about a subject that comes up on a regular basis with our VowelViz enabled speech language pathologists. On a regular basis, VowelViz enabled SLPs ask us if it's appropriate to recommend VowelViz for home use so that parents can use it with their students and reinforce the therapy that they're receiving at school or in private therapy. We do have a number of testimonials from parents who have used VowelViz at home successfully to work with their own children. However, the design of VowelViz, including the vowel quadrilateral, the distribution of the vowel targets, and the IPA symbols, may not make as much sense to someone who does not have an education in communication disorders. So it's important to help parents understand what they are seeing when you recommend VowelViz as a home therapy tool. The majority of the parents that we have record of use VowelViz to support generalizing R to different vocalic R environments. For this reason, I want to talk about a few things that you can share with parents to help them work on R and vocalic R at home with their students. First, I want to take a short look at a PowerPoint slide that does a good job of explaining the personal distribution of vowels within VowelViz. It's important to help parents understand that VowelViz is designed to accommodate all speakers, both old and young, men, women, and children. For this reason, a speaker may not take up the entire vowel quadrilateral with their speech. Rather, it's more likely that they will have a personal quadrilateral that will take up a portion or a section of the design. So their vowels may not exceed all the way to the high front, high back, or low front. It's more likely that their vowels will take up a portion. This blue quadrilateral represents the range of a male with a deep voice. This shape is fairly similar to my personal range. As you can see, it does not go as far forward towards the high front vowels as some other speakers may go. If this is the range for a woman who has a higher pitched voice, you can see that her personal quadrilateral is lower and farther forward in the quadrilateral than the blue. This green quadrilateral is likely to be the quadrilateral of a child with a high voice. So you can tell that not all speakers take up the full range of the vowel quadrilateral within VowelViz, and that individuals with higher voices tend to have lower and farther forward vowels in comparison to the range of all speakers. When you sit down to help your parent understand how VowelViz works, it's also important to help them understand what they're looking at in regards to spatial differences between vowels and R. Help your parents understand that vocalic R is going to look different depending on the vowel preceding the R. Help them understand that back vowels and front vowels look different, both the correct and incorrect articulations. R, or, ear, air. You can see that back vowels must travel forward and the front vowels have to travel backwards. This will also help your parents and your clients identify misarticulations. When back vocalic R's, R and or, will travel to the range of R and stop there. Misarticulations will not go into the range. O, ow. Front vowels will travel from the front to the target, ear, air. However, unlike back vowels, misarticulations will go to the target but will continue through and will not stop in the R target. Eo, eo. One last bit of advice that is nice to share with parents before they start using VowelViz with their children is that you may have to emphasize some sounds more than you would in regular speech, such as R, ear, as opposed to R and ear. Thank you for watching and look for our other upcoming tutorials about VowelViz, vowels, and R.